On Capitol Hill this week, health reporter Lauren Weber will be watching a crucial confirmation battle. It'll play out over 2 days of hearings, and it will put all eyes on Robert F. Kennedy Jr.
Yeah, so Robert F. Kennedy Jr., obviously a member of the Kennedy political family. He did run for president this past year, originally ran as a Democrat, ended up changing to an independent.
And so I've come here today to declare our independence from the tyranny of corruption, which robs us of affordable lives.
And then joined forces with Donald Trump and started what's called the MAHA movement, or Make America Healthy Again.
It was my baby boom generation that unleashed the epidemic of chronic disease that has made America the sickest country in the world.
And he's going to help make America healthy again.
And then Trump picked him to be his nominee for the head of HHS, the Department of Health and Human Services, which is a massive, sprawling bureaucracy that has 80,000 employees to it, that regulates everything from Medicare to Medicaid to your food, to your drugs, to your vaccines. They'd be in the middle of pandemic preparedness. They touch so many facets of American healthcare.
But when Lauren started calling around, a dozen top medical and vaccine experts and public health officials raised red flags, especially about Kennedy's past statements on vaccines.
They said that they were very alarmed that the potential head of the Department of Health and Human Services for the United States could hold any of these beliefs, much less several of them, considering the reams of scientific evidence that contradict him. They said they could not believe that he continued to push the false claim that vaccines cause autism. They said they were alarmed at his ability to undertake scientific reasoning. They said many of the statements he made jumped to conclusions that were not based in science.
From the newsroom of The Washington Post, this is Post Reports. I'm Martine Powers. It's Tuesday, January 28th. Today, we are digging into Kennedy's record on vaccines, the false claims you might have heard already, and some newly unearthed claims that Lauren's reporting has uncovered. And we'll talk about what it all means for the contentious confirmation battle ahead. So, Lauren, when Kennedy appears in front of Congress this week, what are we expecting to hear him being asked about? Like, what are the number one questions you can imagine coming up in this hearing?
Well, considering HHS has such a massive portfolio, I think he's going to get a ton of questions, and they could be about anything from Medicare, Medicaid, and all these other facets that he would oversee. But I think the top question he's going to get asked about is his history on vaccines, because it's very controversial. He holds several opinions and has repeated them over many, many years that, according to experts, are not based in science, and that a lot of his critics have been attacking him for.
And this isn't going to be news to Kennedy, right? Like, he knows that this is going to be something that's going to be coming up in this hearing, that this is something that is very animating, concerning for people in the public health community and also for many members of Congress. What do you expect he's going to say in these hearings? Like, what will be his mission in terms of convincing the people watching this that, like, I would be a responsible, great head of Health and Human Services?
I think he'll say what he's been saying since he was picked as the nominee. He'll say, look, I'm not anti-vaccine. These are his words. I'm not anti-vaccine. I'm just interested in vaccine safety.
I'm not going to take away anybody's vaccines. I've never been anti-vaccine.
I imagine that's a refrain we'll hear a lot.
So, as you say, we're expecting that he's going to essentially say, I'm not anti-vaccine. I'm just asking questions. I just want vaccines to be safe, and that's my mission here. But you have been digging into some of what Kennedy has said in the past and some of the ways that he's talked about vaccines in recent years. Can you talk a little bit about your reporting here?
So my colleague Caitlin Gilbert and I went through hours and hours and hours of over 400 appearances that Kennedy made and talked about vaccines over the last couple of years. And what we found is that he's disparaged vaccines at least 114 times in that time period. He's linked vaccines to autism at least 36 times, which is a claim that medical researchers have discredited. And he's also said that he believes that white and black people should have separate vaccination schedules. He has said a variety of statements that, a dozen top medical and vaccine experts that I spoke to said have no basis in medical science. And he repeats them, and he has repeated them for years.
I want to hear a few more details about what exactly it is that he said, but where did you find this stuff? Like, how did you go about looking for some of these past statements and kind of conducting this very comprehensive look at everything that he said?
Well, I have to give credit to the fabulous data reporters here at the Washington Post, as Caitlin Gilbert and her colleagues managed to pull all of the audio of his appearances on several podcasts, on the website of his anti-vaccine group that he had founded, Children's Health Defense, and various campaign appearances that he has made over the last, 4 or 5 years since the middle of 2020.
So it sounds like you listened to a lot of audio here.
I listened to a lot of audio.
So I want to hear a few examples of what you're actually describing here, Lauren. Can you talk through some of the clips of things that you heard from Kennedy?
Yeah, if you listen to this July 2020 episode of Children's Health Defense show Truth with Robert F. Kennedy Jr.
And this is a podcast?
This is it's a show that's hosted on Children's Health Defense website. So it's a video component, but obviously there's audio as well.
The current state of the science that shows clearly that vaccination is causing autism, and it's one of a suite of autoimmune diseases that is ultimately coming from vaccines.
So Kennedy had a show called Truth with Robert F. Kennedy Jr. that was hosted on Children's Health Defense, which is the anti-vaccine group that he founded. Kennedy has since stepped down from the group's board and as their legal officer. But this was a video that was on their website, and it featured a variety of interviews that he had done on the show, as well as some public speaking events that he also participated in. So in this one video, Kennedy is interviewing someone and talking about the state of the science around autism and links vaccines to autism. And as medical experts and more than a dozen studies have shown, that is false. In another July 2020 episode of the show,
I just wonder, what is going to happen to this generation of doctors when they realize the truth, when they realize they have butchered all these children that we entrusted them with?
Kennedy decried physicians that give routine childhood vaccinations.
All these pediatricians were blindly giving them these vaccines and then ignoring, and they come back injured a week, a month, 2 months, 6 months later. How are they going to live with themselves at that point?
So several medical experts that I spoke to said there was no merit to Kennedy's comments there. They said many of them who are pediatricians or physicians themselves said they sleep just fine at night because they feel like they're actually saving children from disease as opposed to inflicting them with disease, as Kennedy is suggesting in that clip. Another clip that stood out to the folks I spoke with was a July 2023 appearance on the Lex Friedman podcast, where Kennedy talks about the polio vaccine.
But it was in that vaccine, 98 million people who got that vaccine in my generation got it. And now you've had this explosion of soft tissue cancers in our generation that kill many, 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 many more people than polio ever did.
And just to be clear, there is no documented connection between, or scientifically backed connection between polio and cancer rates, correct?
So that has been studied repeatedly over many years to track. And no, there is no believed connection according to the scientific community.
So some of what we're hearing, I don't know, it doesn't particularly surprise me or doesn't sound, totally out of step with what we've seen reported about Kennedy in the past in terms of him saying things that demonstrate a real opposition in some cases to vaccines. But what are some of the things that you saw in your reporting and in listening to all of this tape of him talking in previous years? What was surprising to you or what felt new that you hadn't previously realized Kennedy was saying about vaccines?
I think that a couple of the things that stuck out to the medical experts I spoke to were the comment on the white and black vaccination schedules. And then on top of that,
your chance of dying from the vaccine is 10 times the chance of you dying from cervical cancer.
Kennedy also stated that HPV vaccines have a higher risk of death than the cancer they prevent.
What kind of bargain is that?
Which many of the medical experts said was exactly backwards. They said HPV vaccines are life-saving because they can prevent cervical cancer at very high rates. And to dissuade people from taking a vaccine that can prevent cancer in the future, they felt like was a tragedy. Kennedy also said that vitamin A and chicken soup are the cure, the treatment for measles.
What is the cure for measles? The treatment? Vitamin A and chicken soup.
Which the medical experts I spoke to said is not true. While people can be given vitamin A if they're deficient, and that can be helpful if you have measles, it is by no means a cure. And chicken soup, while it certainly does have nutritional value, is also not a cure for measles.
Are those things that he said on his show?
Yeah, those are things that he said on his show in 2020 and 2021 appearances on the Children's Health Defense website.
Then I want to come back to something you said earlier, Lauren, about Kennedy espousing the idea that Black people and white people should be on different vaccination schedules. What is that about?
So Kennedy says in a speaking event that he argues that Black people have a higher immune response than white people to vaccines. Thus, there should be a different vaccination schedule. So several experts said there's no scientific basis to support Kennedy's claim. You know, while there's some research that found a higher immune response to the rubella and measles vaccines among Black people as opposed to white populations, there's no evidence that there's increased vaccine side effects or injuries. One of the vaccine experts that I spoke to said the study of the shot really does not imply that Black people are harmed by the recommended doses of rubella vaccines, or they would be more or less susceptible to the disease itself.
And why is it concerning, in terms of what you've heard from the public health experts that you've talked to hear Kennedy talk in these terms about, like, vaccinating Black people and white people differently?
Well, public health experts were concerned for two reasons. One, George Benjamin, who is the head of the American Public Health Association, said this is just another example of Kennedy continually taking information that could be factual in one situation with a bunch of caveats and making bad correlations with it. And separately, there's a long history of medical racism in this country that is concerning to have any sort of divide on the immunization schedule suggested, according to these researchers that I spoke to. They were alarmed, considering there is known vaccine hesitancy in various populations around the U.S., and to add race into the dynamic was concerning to them.
So taking these different statements over the years in their totality, how did Kennedy respond to you kind of bringing these back to him and asking him to kind of account for what he said in the past? Now, it's different from what he said in these past couple of weeks where he says, I'm not anti-vaccine, I'm just interested in vaccine safety.
So Kennedy and the Trump team and Children's Health Defense did not respond to our request for comment about his statements. But when previously confronted with his statements, Kennedy has pointed often to his writings on vaccines, saying, quote, I'd actually like to see an example of something I've ever said on my Instagram, on the Children's Health Defense, in my book that's not true. He goes on to say he's an expert in vaccines because he wrote 3 books on them. Kennedy has said that some vaccines can be effective, but he often argues that the risks outweigh their benefits. Medical experts say that is not true. So even while he didn't respond to us, that's typically the response that he's given in the past when challenged on some of these beliefs that are contradicted by science.
After the break, we dig in on why vaccine issues aren't the only reason some Democrats and Republicans may be wary of Kennedy. We'll be right back.
My name is Michelle Singletary, and I'm the personal finance columnist for The Washington Post. When I was growing up, I was raised by my grandmother, who was such a masterful money manager. And I watched her handle her money and talk to me about it. And I like to think that I'm the reader's big mama. There's so much information about your money out there, a lot of it wrong or inappropriate. But when you pay for a subscription to the Post, you're paying for a skilled journalist who has had years of experience, who I hope that you can trust. Your subscription helps pay for my salary. It helps pay for the illustrators, the copy editors, all the people who are involved in putting together the material that you read that could help inform your life. I'm Michelle Singletary, and I'm one of the people behind the posts.
How much will these statements and statements like them matter when it comes to the process of potentially confirming Kennedy as the head of HHS? Like, how much will members of Congress, in particular members of the Senate, even Senate Republicans, like, how much will they care about him saying things like pediatricians have been butchering children by giving them vaccines?
I mean, I think that remains to be seen tomorrow and Thursday and in the upcoming votes that we have for him. So he will be appearing in front of both the Finance Committee and the Health Committee, but only the Finance Committee will be voting to advance his confirmation. Essentially, this is a step before the entire Senate can vote on whether or not he would be confirmed as the head of the Department of Health and Human Services. So this is kind of the first step of many for him to assume that position, assuming that the Senate actually confirms him. You know, what is interesting is that some of his meetings with Senate Republicans have seemingly gone well, where they've said they like his approach to HHS. They, are not perturbed by his abortion statements for some of them. But, Bill Cassidy, who's a senator on the Finance Committee and, had a meh meeting in the sense that he didn't give an enthusiastic response when asked about how he liked Kennedy. I think he's one to watch. McConnell, obviously Mitch McConnell had polio as a child.
Former Senate Majority Leader.
So, former Senate Majority Leader, current senator from Kentucky, has spoken out previously against one of Kennedy's allies who submitted a petition to the FDA a couple years ago to revoke access to a polio vaccine. After that news came out, McConnell put out a pretty intense statement essentially saying that Kennedy would do well to distance himself from any allies that said things like this. So I think McConnell is certainly one to watch in this confirmation hearing process.
And then what about Senate Democrats? Are they united in trying to oppose his nomination?
A lot of Senate Democrats are united, but there are a couple that are also ones to watch. Senator Bernie Sanders, independent from Vermont, and Senator Cory Booker, a Democrat from New Jersey, have both stated some interest in Kennedy's big push to make America healthy again. The two have been really involved in fighting chronic disease and fighting against childhood obesity, and a lot of his policies on these efforts that he's articulated, they're interested in. They would like to see that happen for America. So they're ones where there's some question on where they would vote. Senator John Fetterman of Pennsylvania is also one that some of the medical experts I spoke to who are lobbying on this said they're concerned could potentially vote for Kennedy as well. We have to see. I mean, I think a lot of it depends on how these confirmation hearings go, on whether or not the support is enough to get him through. This will be a tight vote because there are enough, Republicans that potentially could be up in the air about it, that any one of these that could float one way or another could really swing the tide.
But that's what I think is so interesting about this whole nomination or confirmation process and about Kennedy's story in whole. Like, it's not cut and dry that Republicans are in favor of him and that Democrats are against him, that he says all this stuff about our food system that Democrats are actually kind of interested in. And likewise, he says stuff that Republicans really don't like. I mean, he talks about our food system and what he wants to change in ways that have many Republicans concerned that it'll mean bad things for farmers, and that's obviously a big part of their constituency. He's talked about abortion over the years in different ways that have led to some uncertainty about where he stands on abortion. And that is obviously a big question that Republicans are asking. Like, is this someone who is truly anti-abortion? Is he on our side? And so, it is very up in the air how this is all going to play out.
Absolutely. I mean, again, he's now joined Trump to put forward an agenda that is just a compilation of a lot of different interests. And I think it'll be really fascinating what really pops in the next couple of days on this. Also, too, the Washington Post today got a hold of a letter that his cousin, Caroline Kennedy, who's the former ambassador to Australia, sent calling her cousin a, quote, predator, saying that he's preyed upon victims such as family members to parents of sick children in his crusade against vaccines.
And this was a letter that she sent to lawmakers. So how has RFK Jr. responded?
A spokesperson for RFK Jr. did not immediately respond to requests for comment with regards to his cousin's letter.
I think important context for people listening to understand is that as this confirmation hearing is proceeding and Kennedy's going to be asked all these questions, there are other things that are happening in the public health world and specifically in health and science agencies that have really raised the alarm among some public health officials and things that President Trump has already started to carry out in his first little more than a week since he became president. Can you talk through some of the changes that have been implemented that people have started to express worry about?
I mean, one of Trump's executive orders was to pull out of the World Health Organization, which obviously it has large implications, not only for data sharing between countries, but also in potentially pandemic preparedness and how the U.S. would work with other countries in the event of some sort of global outbreak. Trump has essentially frozen global AIDS funding via USAID. The CDC nomination is still kind of looming. And again, that's the Centers for Disease Control and Prevention. That would be underneath Kennedy if he's confirmed. And obviously, the CDC director would have a lot of power over, how different recommendations are made for disease in this country. Also, they would have a lot of power in terms of how they deal with the potential bird flu outbreak that gets larger than what it currently is. And domestically, you're seeing these communication restrictions that have caused chaos across a lot of health agencies. Grants for some studies are in limbo as this communication pause has been put into place. Disease reporting and surveillance isn't being made public currently, which some of them have been paused. And, the administration said these pauses are temporary, that they say they're working through this to kind of set a new agenda. But there's a lot of chaos right now. There's a lot of people that don't know necessarily what's up from down. And it remains to be seen that if Kennedy was confirmed, what could come out of this? He said he wants massive change. I mean, he's talked about firing reams of government employees and instituting a whole new focus on chronic disease and looking at things like obesity very differently. We'll see. I think it depends on whether or not he gets confirmed what actually happens on these things.
Lauren, thank you so much.
Thank you.
Lauren Weber is a national health reporter for The Post. That's it for Post Reports. Thanks for listening. If you want to show your support for the show, please subscribe to The Washington Post. Not only is it a great way to help us continue to do this work, but you can now get access to Washington Post podcasts ad-free in Apple Podcasts. Subscribe in Apple Podcasts or by following the link in our show notes. Today's show was produced by Alana Gordon. It was mixed by Sam Baer and edited by Rena Flores. Thanks also to Stephen Smith and Caitlin Gilbert. I'm Martine Powers. We'll be back tomorrow with more stories from The Washington Post.